Vaginal rejuvenation is becoming an increasingly interesting topic to women, and we see patients from around the country for this type of operation. There's a lot of confusion about what it is, and I want to spend a little bit of time talking about it. There is a catch-all category called vaginal rejuvenation, and this is more of a marketing term, and it doesn't explain exactly what it is. The idea is that a woman suffers from childbirth injury, which can affect sexuality, it can affect self-esteem, it can cause prolapse of pelvic organs, and this is where the vagina can be rejuvenated, making sexuality better for a woman before she had children, before she was sexually active. This is a cross-section of the woman's body. This is the front. This is the back, this is the bladder where a woman pees from, rectum where you poop from, and the uterus and the vagina where your babies or sexual activity. Now you can picture a baby's head filling the vagina. This is the pubic bone right underneath the pubic hair, and this is the backbone. The baby's head fills the entire area through here, and the baby's head will descend through the pelvic floor. And when that happens, organs can drop out over time. The medical thing that women experience with pelvic organ prolapse is the bladder can fall out, the rectum can fall out, the bowels can fall out, even the whole vagina can fall out. Evaluating for pelvic organ prolapse is a very important part of planning vaginal rejuvenation, and a surgeon should be very familiar with these concepts. Externally, this is, my wife's an artist, no, I am not, but this would be a picture, a schematic diagram of a woman before she's sexually active. There won't be any relaxation, there'll be an intact hymen. After a woman is sexually active, the hymen is ruptured and the opening to the vagina is a little bit bigger. Once a woman has children, there can be significant breakage and relaxation. Vaginal rejuvenation externally, this would be called a perineoplasty. We would bring the vagina back to where a woman was before she was sexually active. Now, this is just the external part. You can picture what a vagina would look like in terms of the canal. If you picture a one-finger breadth vagina, which would be about what a virgin would be, the whole canal would be something like this. Now, once a woman's sexually active, typically she'll tolerate a speculum exam well, and it'll be about 2 finger breadths, or it'll be about something like that. Now, when many women come to see us for vaginal rejuvenation surgery and vaginoplasties, many times they can accommodate 4 fingers or even more. Forgetting about 4 fingers, if you just put 3 fingers in, you can see that the whole vaginal canal, that there's a significant amount of laxity. So the surgery is, a vaginoplasty is fixing the outside, figuring out what a woman wants to look like, what a woman wants to look like on the outside, and reducing the caliber of the vaginal canal to get her more akin to what she was when she was 18 years old. So the surgeries, we do most of the surgeries in our office operating suite with IV sedation and local. Patients tolerate it very well. We have a lot of patients coming from out of state. After the procedure, they'll stay in a local hotel assuming that they're healthy. Sometimes we'll do the procedures in the hospital as well. We evaluate everyone for fixing pelvic organ prolapse as part of the operation, and then we do a vaginal tightening procedure or a vaginoplasty. If you have any questions, please feel free to give us a call. I'm happy to do phone consultations, explain everything in depth. Thank you.